also, I am a clinical physiatrist, so my specialty is physical medicine and rehabilitation. And what that deals with is lots of different stuff, but how it's applicable today is I take care of a lot of people with disabilities, whether it be strokes, multiple sclerosis, spinal cord injuries, and things like that. And then also help with sometimes when people become more frail. Maybe they are actually struggling to stay home. So I'm going to ask the first question today. Who here, whenever they're settled, and maybe it's, hopefully here in Grays Harbor, or maybe they want to move in Hawaii, but who does not want to live in their home as they age? And for those online, nobody is raising the hand, right? Because that is our goal. We want to live successfully, we want to have good quality of life, and to do that, we need to live safely at home. And that's what we're talking about. So I will do a couple things today. Number one, just what do we know about the goal of staying home? Some things that people worry about or maybe concerned about as they age, or maybe as they're dealing with a disability, what challenges that they may have. Understanding the aging process in general, right? There's only one way to beat aging, and we don't want to have that alternative. And so how do we deal with the aging process and ultimately understand it? And then that gets into the next step. How do we age better? Obviously, we want to prevent falls. We want to prevent injuries. Sometimes we need to make changes into our home itself, that environment, to actually be safer. And so we'll do all that and then obviously have times for questions and discussions as well. So a few years back, the American Association of Retired Persons actually sent out a survey, about 3,000 people, and they asked, well, do you want to stay in your home? And they didn't ask if they wanted to stay in a condo Hawaii or something like that, maybe that changed things. But well over, two-thirds, well over three-fourths of the people actually said, yes, I want to stay home as I age, which isn't surprising whatsoever. People want to be independent. They want to feel that they're safe. They want to be in a community where they already know people, right? And as they do that, though, they realize that there will be challenges associated with it. And so, they know that there are some barriers to actually staying home. And in fact, 71% of people say to do that, their house has some accessibility issues, and they may need to adapt things for that. The bathroom is a primary area. 80% of people think, okay, maybe I'll need a shower chair, or maybe I'll need to add some grab bars or something like that as I age. If I become weaker, I'm more likely to fall. Almost two-thirds said that they may need an emergency response, something, basically an alert that they can use if they fall or having a challenge to get help, in particular if they live alone. And then if people can't live at home, they're like, okay, I'd be willing if I had a loved one or somebody else who I knew could help me out, maybe live with them or have them live with me, or potentially get into an accessory dwelling unit or something to that extent to be safe, but still that general feel of what that would be like. So unfortunately, we all age. Now the reality is we all age differently, and there's a lot of factors that contribute to our aging. The first is their genetic, right? We know families, or hopefully you're part of a family where everybody lived to at least 80, 85 years old. And if they didn't live to 90, you consider that they died young, right? And then we also see families where maybe there's a genetic condition or another problem where people die, into their 60s or 70s, which most of us consider pretty young nowadays to die. We know that there's lifestyle issues as well. So we'll talk more about this later, but smoking, alcohol, and drugs, if people have those habits or those dependencies, then they're much more likely to die younger for multiple reasons. There's environmental factors. On a global scale, let's say you live next to Chernobyl nuclear power plant, right, in the former Soviet Union, and you're exposed to radiation. Well, that's going to change the life expectancies of those people. But there's also micro levels too. So for instance, maybe you lived in a house with lead pipe, right? And that impacted your health. Or potentially you worked in a job where you're exposed to asbestos, and that impacted your long-term health. There's illness history. Some of it is, if you had a history of cancer or a history of stroke, you're more likely to have cancer or stroke in the future, and each of those could obviously decrease your age. And then quite frankly, sometimes there's luck. And we all hear about this person, and it's always very rare, but you're talking to somebody and they're like, oh yeah, my great-grandpa lived to their 95 and they smoke and ate bacon every single day. And for whatever reason, that person, was it genetic or just luck, happened to live better, where most people wouldn't live to 95 if they had those habits. So what happens to us as we age? I'm going to mention a lot of stuff, and the reality is I'm probably not even covering half of it. But first of all, our cardiovascular system. So as we age, we're much more likely to have hypertension, makes our heart work harder. And then in addition, we're more likely, those blood vessels in our heart are more likely to get cholesterol plaques, or what we call coronary artery disease, which decreases the efficiency, how well our heart works, but then also makes us more likely to have a heart attack, right? And so that's a component of it. In addition, we have what's called our maximum heart rate. So when we're younger, our heart rate can get up much higher, so we can actually expend much more energy, but that decreases as we get older. Tied on top of that, the heart actually becomes less efficient. So it can't pump quite as hard, and it actually can't in many instances, because the heart will begin to stiffen, or sometimes there's other issues, the heart will not be able to pump out as much blood. So if you have a heart that can't go as fast and then can't pump out as much blood, so it's less efficient. One of the most important things that it does, of course, is it carries oxygen to the rest of our body. So you throw on top of that, we have changes to our respiratory system as we age as well. So for instance, we have these little, I'll call them balloons, but they're very, very small in our lungs. They're called alveoli. And what they do is that's what absorbs the oxygen, that we breathe in. They're absorbed into these alveoli, enter our bloodstream, and then transported throughout the body. Over time, these enlarge it, and we have less of them, and so there's less surface area, so we're getting less oxygen as we age into our bloodstream. On top of it, we lose elasticity of our chest wall and our diaphragm, so we can't, one, exhale as quickly, and two, we can't take necessarily quite as deep breath as we age. And then the final thing is our lungs naturally sweep themselves. And those are called cilia. And basically they form the natural brooms of the lung, propelling different secretions, stuff like that, bacteria out of the lung. They also don't work as well as we age. And so what you now have is a system that, one, can't pump as much oxygen, but then two, on top of that, we're not getting as much into our bloodstream. Other factors, our muscles. As we age, we can lose 30 to 50, that's 50% of our muscle mass with time. And then on top of it, the quality of muscle can change. So it can become infiltrated with fat, and so it loses some of that strength. On top of that, with that, we have a longer time to recover after injury. And our bones, we get what's called osteopenia, weakening of the bones, or osteoporosis, where actually our bones become so weak that they're at a risk for potential fracture, and we lose 0.5% of our bone mass on average each year. I think it's once we reach about 40 or something to that extent. So our bone mass declines on top of that. And that doesn't also include all the things that happen to our joints with arthritis, tendonitis, all those sorts of things as well. Our nervous system, unfortunately, also will change with age. We lose brain mass. With that, we get decreased working memory as well as general executive function. And that's things like planning, multitasking, those sorts of activities. We process more slowly and are more likely to be distracted. And it's not just our central nervous system, but our peripheral nervous system can be impeded, as well as our autonomic system on top of it. Now, I know I'm saying a lot of doom and gloom, only a couple more slides of that, and we'll get to some happy stuff, all right? So, other impacts, as we know, are, I see this myself, I have my readers, I have my drivers, at some point I'll be wearing glasses all the time, but our visual acuity decreases, our hearing decreases, people have challenges with urinary incontinence, declining in our immune system, so we are more likely to get an infection if we're exposed, and it's also potentially more likely to make us more sick if we're exposed to certain problems. Our endocrine system, which I won't go into all the details, but that will slow, so we're more likely to potentially gain weight. That also comes with decreased muscle mass. But there's a whole other host of things that occur. But if people smoke, they use significant amount of alcohol, and for men that would be considered more than 2 drinks in a day, and women 1 drink a day, God bless you. Or if they use any drugs, that actually speeds up that process. And it's interesting, people historically thought of just, cigarette smoking causing cancer, but the reality is alcohol, other drugs can actually contribute to that as well. So across the board, generally you'll see damage to the heart and lungs. You see increased risk of cancer, challenges with increased dementia. Not to mention, if you do need accommodations at your home and say you smoke, on average that's about $3,000 a year. And obviously alcohol, illegal drugs can be very expensive as well, increase your risk of stroke, but then there's multiple other things. So one of the best things that you can do, say if you smoke right now, is to quit, because that will slow that aging process for yourself. So here's basically kind of an analogy. This is by this gentleman, Dr. Taffet, and he has the idea of the precipice in aging. And the idea is when we're young, we have a lot of reserve. He has a lot of reserve right there. And so that means if you get sick, you get exposed to an infection, maybe you have an injury, you heal up well, but you could see, you see kids, they get sick, they bounce back right away, right? In a children's hospital, even kids who are very sick, you can watch them play in the hallway. But as we age and we lose that reserve, what can happen is eventually, if there is an insult, and maybe that's a cardiac event, maybe it's a bad infection, it can cause other things to fail as well. And they describe it, unfortunately, as then causing significant outcome, hospitalization, or of course, even death. And so with less reserve, of course, we're also more likely to fall. And we already know that we lose muscle, that we have nervous issues in terms of both central nervous system and peripheral nervous system. People, though, also with the decreased vision, it's night, you're more likely to fall, right? You have cataracts or another issue there. People are more likely to have dizziness as well. And then blood pressure control. People can get what's called an autonomic neuropathy, where the heart, for instance, when I stand, what naturally happens is my heart should be going a little bit faster, and then my blood vessels should contract, basically maintain my blood pressure. As we age, for some people in particular, say if they're diabetic, when I stand up, it may take a while for that to process, and therefore when I stand, right, or particularly if I stand and then walk, I may be more likely to fall. So that's all the bad news we're going to go through. Now let's talk about what we can do to age as well as we can and keep us safe at home. So this is an incredibly important study that was done about 20 years ago. It's called the Nurse Health Study. Quite large. It looked at 121,000 nurses and followed them for, I think about 20 years overall. And they just kind of asked the basic question, what lifestyle things help these people to age well and to have good quality of life and then longer life? And what I'm going to say will probably not be a shock to any of you. If people maintain a good weight, they exercise regularly, they did not smoke, and they ate a healthy diet, they all did better, right? So, in fact, those who are not overweight, never smoked, exercised an average of 30 minutes per day, did some drinking and didn't drink to excess and ate healthy. On average, they lived 12 to 14 years longer. But then on top of it, they were much less likely to have a stroke or things to that extent, which would greatly decrease not just the length of life, but the quality of life. So here's the trick. A lot of people will talk about how to, what do we eat, how should we eat, and I would say a couple things. There's two different scales. This is more that classic healthy eating pyramid, and here's the Mediterranean diet. But the great news is they are very, very similar. And so the first thing actually in both of them is actually trying to emphasize, the exercise, the social component, which are very important for us as people as well. And then that next tier, where you really should get almost all of your calories, should be things such as fresh fruits, fresh vegetables, whole grains, healthy oils, something like olive oil, things to that extent in terms of eating your calories. Eat much less frequently, but it could be even up to every day. Things like fish, poultry tends to be a little better than obviously red meat. Nuts, seeds, things to that extent. As you go up, a little bit less, so they're talking, a few times a week, chicken, cheeses, things like that. And then very rarely the more fatty meats, red meats, bacon, of course, which is tough, but it's what it is. And then obviously your sweets and things like that. Basically everything in the middle of a grocery store, we shouldn't be eating. And the one thing I always like to say to all my patients are the people who sell food are not our friends. They specifically design food to have more fat, more sugar, and more salt because that is incredibly appealing to us as humans, and it sells more food. And so look at the packages, because here's the other thing, something could say that it's low fat and it tastes really good, but that's because it's high in sugar. And it could say it's no sugar, but then it's really high in fat. And then ultimately look at the calories that you're consuming as well. So here's a couple easy tricks that can help people in many instances lose weight. And the first is, how do you control the temptation? Because I know if there's a good sweet food that I like, my ice cream is in front of me, I'm gonna want to eat the ice cream, right? I know for a fact there's macaroons here, for those who aren't in the audience. I will probably have a macaroon before I leave here, because it's out there, even though it's coconut and it's fatty, which is different, but that's all right. Just one macaroon. But so don't have foods that you think you should avoid in your house, because if they're in your house, you're eventually going to eat. And then here's another trick: don't go to the grocery hungry. In fact, studies have shown that it won't just help your waist, but it'll also help your pocketbook. Because when you go to the grocery hungry, we spend about 1.5 times more than if you go when you're full. And then if going to the grocery is a temptation for you, because then you see those Oreos or whatever your sweet of taste is, a great trick is to actually use curbside pickup. And nowadays there's a lot of places where it actually is easier for you because you don't have to walk around whatever store is the store of your preference, but you avoid that temptation, right? And then you just buy essentially what is on your list. And here's one thing that the gas stations, no offense to anyone who owns a gas station, don't want you to know. Most of their margin doesn't come from gasoline. It comes from all the stuff that you could buy inside. And so if you're somebody who tends to be tempted by going in and then you see the soda pop or the Fritos or the Snickers bar or whatever it may be, pay at the pump. And I know sometimes they charge you 5 or 10 extra cents, but the reality is, how much money would you be spending on that soda pop or that candy bar? You would, you spend more on that anyways if you go in there and buy the food there, because almost all the food they have in that type of store is processed and ultimately not good for you. Another trick is your vegetables. One, we know that people who eat 5 servings of fresh fruit and vegetables, and in particular vegetables a day, that they live longer, their cholesterol decreases, and they maintain better weight. So not just being healthy for you, it tricks you, because vegetables actually have a lot of fiber, and so then they make you feel more full. And so in fact, when you eat, if you actually start with your vegetables, you're probably better off, because you're more likely then to avoid the other food that may not be quite as healthy for you. And then another trick, I don't know how many of you were told by your parents that you need to eat everything that's on your plate. I know that was for me, right? And so another trick is we have that mindset. And so use a smaller plate, use a smaller bowl, and then another trick is don't have things touch. Because what happens is after we eat, it takes another 10 to 20 minutes to actually feel full. And so if we eat that first plate nice and slowly, we'll feel full. It's going to be a bigger effort to go get seconds, right? And so you end up eating less and you're able to lose some weight. Cutting out sugary beverages may be one of the easiest things that people can do. So a can of Pepsi Cola has 150 calories, Coca-Cola has 140. Some of them like root beer and stuff like that, can soda be 160 plus calories. So if you cut out a soda a day, you may lose 10, 15 pounds in a year if you're drinking a soda a day. People often drink for calories. For instance, I had one person I knew, and that person was drinking 700 calories of coffee creamer a day. So look at those calories. What's coffee creamer? It's fat and sugar, right? That's why it tastes so good in your coffee. So count those calories, avoid the hidden calories, because they don't even make you feel full. So then you're going to eat as much as you normally eat, and then you just toss on those additional calories. Here's another trick. Dressings and that type of stuff that you add to your food, they don't make you feel that full, but they're packed with calories. So 2 tablespoons, that's not a lot, right? 2 tablespoons of ranch dressing, but I could just as well say blue cheese or Thousand Island or anything like that, has 100 calories. So almost as many calories as a can of soda is in that 2 tablespoons of dressing. So you get people who say, hey, all I'm eating are salads, why am I not losing weight? Well, what do you put on your salad? Oh, I put probably a 1/4 cup of ranch dressing and some cheese and some bacon and some ham. And
I feel like called out.
I'm just telling the truth. Honestly, we do, but they end up having more calories in that salad than if they actually would have bought the burger meal at Burger King, right? With the French fries and the hamburger. So watch that unnecessary stuff, because it's an easy way. Because here's the thing, when people make too big of a change, it's hard to keep it up, right? And I think we've all seen people who've gone on the grapefruit diet or the all juice diet or whatever it may be. And sure, they may have lost weight really quickly, but how many of them have you actually known to actually maintain that weight? Not too many, at least not in my experience. Because 1, it wasn't sustainable. 2, what they did is they lowered the amount of calories they consumed too quickly. And what happens is we actually slow our metabolism. And sometimes we can actually slow our metabolism permanently. And then what occurs is they go back to what they were eating before, their metabolism is now slower because the body naturally wants to maintain itself. And they don't only just regain the weight, they gain that plus. So slow and steady really is the best way to lose weight. And then once again, the vegetables are key. And you could be the example, there's your church potluck or whatever it may be. You bring the veggie tray, but hold the ranch. Physical activity is one of the best things that we can do for ourselves as well. The recommendation is about 150, that's 150 minutes every single week. Ideally, it's not in obviously just one day, but we're doing it at least 3, 4, 5 times a week. Try not to miss consecutive days, and then adding some strength training 2 to 3 times a week on top of it. The strength training is actually very important. It's because we gain muscle. When we gain muscle, 1, it helps to protect us from falls and things like that. But then 2, it's good for our bones. And then the final component is muscle to maintain. You burn calories when you work out, but muscle also needs more calories to be maintained. And so it actually is one way to actually increase your natural metabolism. But here's the thing. I say that right now, and some of you may say, well, I can't do that much exercise. Then do more. In fact, we know that when people, let's say you have a desk job or just sit around all day, if they just stand for 5-10 minutes, they actually burn blood sugar, right? And so a little exercise is better than no exercise. A moderate amount is better than a little, and then obviously a lot is better than a moderate amount. So if you can't do that, don't shoot yourself for it, but do more, right? If you do more, we know that people will be healthier. It doesn't have to be perfect to be better. So, any questions, by the way, about exercise or nutrition, things like that, before I switch over to some techniques and the things we can do in terms of home planning, that sort of thing? Not hearing any questions, we'll continue. So the first thing I would say is plan ahead. So think of your current condition, kind of anticipate maybe what you may have genetically in family, what help you need right now, and plan ahead. Because the problem is, if somebody suddenly ends up in the hospital because they developed pneumonia and they were borderline at home before because they didn't put in that ramp or they didn't have those grab bars in the bathroom, they're going to end up having to go to someplace else, at least short term, until that is made. So plan ahead now and don't wait for a crisis to begin to make those changes. And actually, I'm going to talk a little bit about resources that we have now at Summit that will really help do that or help you with that. And then obviously have conversations with loved ones and whose help you are depending on. Because what you don't want to do is assume that maybe your daughter Sue is going to be available to take care of you if something happened, and in fact that was not in Sue's plans, right? And then you need to look for other potential resources that might be able to help you in case you need further assistance. So plan ahead, have conversations so everybody's on the same page with those expectations. And then as you think about what you might need, go ahead and make those changes now before you really need them. Because the other problem is if you don't, and then say you fall in the bathroom and you have a hip fracture or something to that extent, well, once again, will you return home or not? It's tough to say, but maybe you could avoid that by being proactive with those changes. And then know what resources available. There's just have two up here, Olympic Area Agency on Aging and Community Coastal Action Program, but there's lots of others in the community, and so they can help people with that. And potentially one of the most important things then is discuss your health with your provider, because that's critical for planning. And one thing to look at is your medications. So as we age, hey, come on in. As we age, what happens is often we're getting on a lot of different medications. And absolutely we need medications, right? But I had a professor once in medical school said, remember, you always have to be careful when you prescribe medications because ultimately they're controlled poison. They're having impact to change the body, right? And we look at risk and benefits, and generally they help people, but we need to constantly reassess, consider how they're interacting with each other, and consider if they're needed, and then also consider if they're needed as the body changes. So for instance, an example would be antihypertensive medications. I'm not saying to anybody right now, you should or you shouldn't be on those medications, but as we age, potentially we're more likely to fall, more likely to have that problem where blood pressure may drop when we first stand. Should we be on 3 antihypertensive medications, or should we look at the risks and benefits and say, well, maybe you only should be on 2? That's a conversation that each person has to have their own provider, but it's something that you should feel enabled to have that discussion with your provider. And so consider deprescribing. We know certain what are called psychotropic medications, so those are medications that might be anxiety medications, sleeping medications, those type of things. As we age, we tend to be much more sensitive to those, and we know that there's a correlation between those medications and falls. Sometimes we say, well, it's worth the risk, but it's something to consider, and once again, have those conversations with your provider as we age. Got to talk about bone health, right? we know that as we age, our balance goes down, we may be more likely to fall. Well, if we do fall, we want as strong of bones as possible, so that way there is no fracture and we quote unquote bounce back from that. Talk about preventive measures, and actually, and so that would be our cancer screenings. If somebody does have a history of recent smoking, do we need a low dose CT scan to look for potential lung cancer? Do we have our vaccinations? Because what we know is over time, an example is varicella. So that's a chickenpox. There's a vaccine now for chickenpox. I wasn't available. I actually had chickenpox when I was younger. But over time, our antibodies, which are the cell, basically the components, our white blood cell system that protects us from infection, that wanes. That immune system isn't as strong. Our antibodies may decrease with time, and that's why you get that shingles booster, right? So that way I hopefully don't get shingles. I turned 50 a little while ago. Got my shingles booster because I don't want to have shingles. But that's the reason why people get the pneumovax, but then talk to your provider about what vaccinations you may need, because we know people who are elderly, you don't have the reserve, and therefore being vaccinated, get your immune system as strong as possible is really critical for you. And then talk about your status of what you would like done. Meaning, if myself, if I had some severe neurologic impairment and I needed life support and didn't know how I was going to do long term, but I knew I wasn't going to do well, I talked to my wife about it. I wouldn't personally want to be kept alive in that situation. And my decision is my decision. That is up to each person as an individual to determine what's important in their life. But you need to have that discussion, one, with your provider, but then two, please have it with whoever would be your decision maker also, and probably that next person in line too. Because if something happened to you, that person then becomes your delegate. They can make a decision potentially that you may not even want, so you need to have that conversation with them proactively. And one thing that I really, really want to emphasize is what's called a Medicare wellness visit. We do these here at Summit Pacific. And what it involves is, it's a nurse-led visit, which really looks at people, looks at the risk factors for multiple issues, really looks at your health history, what testing that you may need to do. It does a whole bunch of other assessments, and then works with your primary care provider to really come up with a good plan to keep people healthy. So definitely consider to get a Medicare annual wellness visit if you're eligible for that. Exercise is critical. It's one of the most important things. I truly believe God designed us to move. And fall prevention, Tai Chi is a great example where we've been studied, actually prevents falls. But the reality is there's lots of different exercise programs that do prevent falls. So just by gaining aerobic strength, by gaining muscle strength, we are much less likely to fall and less likely to get hurt if we do fall. Physical therapy is a great way to get in there. They can do assessment for you. They can design programs specifically around, let's say you have some physical challenges or some other challenges around that specifically. But in addition, between those physical therapists and your provider, maybe you need a walker or a cane or another assistive device, they can help you with those. And here's the other thing, if you do have an assistive device, you want to make sure you're using it correctly, because otherwise that could actually make you fall. And the thing that we don't think about is often, we actually have an occupational therapist in our room who I'm going to introduce in a moment, we don't think about is occupational therapy. And the great thing about OT, I don't know if you remember the show MacGyver, but he could jerry-rig anything. And I think OTs are the MacGyvers of healthcare. They solve problems. So maybe you're struggling with your home architecture and you need to know, what can I do to be safe? They can provide those recommendations. One way is a home assessment, and I'll talk more about that in a moment. They can talk about fall prevention. They can talk about energy conservation. If somebody maybe had a stroke or something to that extent, they can even talk about activities of daily living, how people dress themselves, bathe themselves, all those sorts of things. So when you look in the home, it's really important before you make changes, make sure that you talk to somebody who is an expert. So for instance, you don't want to just toss a ramp in. You want to understand that for a ramp to really be safe, the rise, meaning how tall it should be, for about every inch you go up in height, in my case it's much shorter, you should actually stretch the ramp out by a foot. And that really is the safest way to have a ramp. Tripping hazards, assessments, night lights, those are all modifications we can use. But then if you look like at the bathroom situation, where do you put your grab bars? Well, one, make sure you put them into your studs in the wall, right? How do you put those in? Occupational therapy to actually kind of help with all those assessments. Here's some other things. So for instance, let's say you have a bum knee or another musculoskeletal or neurologic problem where I'm weak, say on the right side. There's techniques and strategies we use. So for instance, when I walk up the steps and my right leg is weak, well then I should be going up. We always say up with the good. So to use that left leg to push myself up, because what I don't want to do is to rely on the weaker leg to support my body weight, because I'm more likely then to fall either forward or backward. And then reverse down with the bad. So when I am going downstairs, I want to basically then take the weaker leg, put that down. In this case, it's my right leg. I put that down first, and then that way most of the weight is on the left leg, and then I continue through. So up with the good, down with the bad. Other equipment that might keep us safe are reachers, utensils. Now there's all kinds of cool assistive technology. So if I don't, my blinds are real high, I don't want to close them every night. Now those can be electronic. There's all kinds of cool stuff actually as well. So I want to introduce, her name's Lindy Hawkins. She's occupational therapy, but then also our manager for all of our rehab services, to maybe talk to us a couple moments, Lindy, about what we have. Tara Lobo is one of our other occupational therapies. Yeah, please, Wendy, about what our new program that we have for judging home safety assessments.
There's a bright light here, so I'm going to say it anyway. So as he said, my name is Wendy. I'm an occupational therapist by trade. I am the manager now, so I don't really do any therapy services anymore, but I do have the privilege of working with a fantastic OT by the name of Tara, like he said. And we decided that we have identified a need in our community. Just what he is speaking about today is the opportunity to have that aging in place. And so as an occupational therapist, we have the ability, like he said, we know the creative ways and we know what to look at and we know what to do to provide resources, education and things like that for people so that they can stay in their home. For example, I'm going to share a quick personal story. My father was at home and he was deteriorating pretty quickly. He had a lot of medical needs and I was able to bring him home from the hospital and, getting him around. Something as simple as the part of the couch that he always sat in was really no longer accessible. We could get in the couch, sit down, but he couldn't get up. So my OT brain clicked in and we immediately started MacGyvering everything and we figured a way. That was his favorite place. And so it was important to him to be able to get to that recliner and that particular part of the couch, and we figured it out. So that was the first thing. And then the other big thing for him was that the way his bathroom was set up, it was a regular commode, no grab bars or anything like that because he didn't need them before. Well, now we get him home and he can't get off the toilet. That's a big problem. Did my mother call a handyman to get a grab bar? Of course she did. But fortunately they have an OT as a daughter and I happened to be there. So I had the ability because I knew what his range of motion was. I knew he couldn't raise his shoulder very high. I knew what his strength was. I knew what his balance was. I was able to work with the handyman and we put the grab bar in differently than the handyman would have because he didn't know everything that the occupational therapist did. Does that make sense? And so that's what we can do different than maybe other professionals. So here at Summit Pacific, one of Tara's passions is exactly aging in place. And so if you have a need or a loved one that has that need and you feel that maybe having an occupational therapy assessment to look at some of those things is warranted, then please just ask your physician for a referral. to our outpatient therapy, occupational therapy clinic. And really, don't worry about this part, just ask for the referral. But if you did remember, ask for aging in place assessment or home assessment, and then that will trigger us to know what we need to kind of cater the assessment to. And in that assessment, what she'll do is you will actually come to our clinic downstairs, and she will take you through an assessment including your strength, your balance, your range of motion, and really see where maybe some of your deficits are. And then if warranted, she'll give you a pretty robust, comprehensive home assessment, kind of like homework, where you would go home and maybe measure some doorways. You might be looking at, she may ask for some pictures of your bathroom so that she can see what some of the challenges may be. It could be something as simple as a one-time visit, or it could be a couple times that you would come in and work with Tara. Is there any questions on that, of what I've presented?
Are there certain types of insurance that don't cover that assessment?
No, so it is, it falls within the occupational therapy scope of practice, so that's a really good question. And your physician will give diagnoses like high risk for falls, functional decline, and so then that will cover it under the insurance. Any referral that comes to us, we do check your insurance, so if there were something that really didn't, check out, we would let you know that. Good question. Yeah, great question. Any other questions? Okay.
So if you did need like a grab bar or something, is that something that then the occupational therapist would put in a like prescription for, and would it be covered by insurance, or would that have to come out of pocket?
You have very good questions. I'm glad you're asking them. So yes, so Tara can make recommendations, like maybe you need a grab bar that is horizontal or vertical or whatever, and she can make even recommendations of this length or with texture, things like that. Typically, they are not covered under the insurance with a few exceptions, but that is something that she would provide recommendations for, and even to the point of providing some resources. Maybe they're available on Amazon or they're available at Home Depot. Here's what we recommend. And then some of the ones that Dr. Cassera has pointed out on here, there's some resources, and she would have kind of a list for you and go over some of those things. Yeah, other questions? Yes.
Is there, aside from what Tara offers, is there a program around the harbor that maybe you're familiar with that would actually send an individual to that patient's home to measure them? Let's say a widow or widower was living on their own. Maybe they don't own a tape measure. Maybe they don't have any nearby family, or they wouldn't think to measure the width of the bathroom door, their closets, or whatever. Is there someone that, like a program that does that, where they do like in-home like assessments?
Really, the only thing I can come up with is home health services. Yeah. It would be something where, and you do have to qualify for home health services, so there's backing up, there's some criteria you have to meet. But if you did qualify for that, that is something that a PT or OT could and would do in that case, yeah.
There may, I was just thinking in terms of a potential other option, in terms of some help. Now, this wouldn't be an occupational therapist necessarily going to the house. Let's say there was need help with measurements and things like that, or volunteers. So for instance, I've had, when I worked in a different county, I had success going to the Rotary. Somebody needed a ramp, and the Rotary would build ramps for people as part of their philanthropy projects that they did. I don't want to speak for them, but that's maybe a time where someone could go to like Olympic Area Agency for Aging and see what they may be able to provide, because they may be able to provide some of that stuff. Sometimes also people can't afford certain equipment, and maybe it could be grab bars, but it also could be maybe they can't afford a walker or a shower chair. There are closets, through different visiting nurse services, other different organizations, where they will either loan those or give them to people, or B, they will sell them relatively cheap. Or quite honestly, Craigslist or Facebook whatever that, I don't even know all that stuff, but, whatever those different sites are, sometimes you can put something like that in it, and once again, you can get it cheap. You just gotta make sure then that it is good and solid and going to maintain your weight and stuff like that.
Cosmopolis Lions Club
Thank you,
has a,
thank you, sir.
Great, thank you.
Just in case you couldn't hear, because the gentleman said it was behind, the Cosmopolis Lions Club has some of these types of equipment. Thank you.
Good.
Cool, thank you, that's great. So we're getting to the point of wrapping up. So aging well, there's no secret to it. I think we all know what we need to do, right? It's maintain a good weight, exercise, avoid alcohol, tobacco, drugs. And then the next step is really discussing your desires with your loved ones, your care teams, and being proactive to make these changes now when things are going well, rather than to wait until when you really need the help. So be proactive about your health, be proactive about your planning, and that's the best way that we can age well in place. I would love to entertain any questions if anybody has any. Yes, sir.
I have an answer.
Good, that's even better.
The O3A, the Olympic Area Agency on Aging, has a senior emergency fund where they will, you have to discuss it with them, but they will provide up to $500 to take care of things. And then they do have people that will help with paperwork if you're doing Medicare, Medicaid, and they also have programs available that you have to go through their questionnaire to find out if you qualify for being on their services.
Excellent. And so just in case you can't hear, if you were online, the gentleman is behind there. He was mentioning that the Olympic area of aging, I would say it wrong, I'm sorry. But he was saying that they can actually, in many instances, after application, so you have to be approved, can supply up to $500 for different needs in an emergency. And so that's really great information. I'm glad you shared that. Thank you.
Would I be able to reach out to you and get some more information on that,
Absolutely.
and I can
Yeah.
put it in the comment section? Okay, perfect.
We'll not hear any more questions. I just thank you guys all so much for your time. And thank you to those who are online as well. Have a great day.
If